I was a kid, I remember going out and we're in public and we could see a physician or a dentist, and my mom and dad would say, hey, listen, you better straighten up. There's a doctor over there. And if you come from an Italian family, you know that if your mom says that, you better do it. And so what would happen is we'd go into the office and they would know everything about us. It was really weird. I mean, they would know what sports we're playing. They would know everything about our parents, everything about our grandparents. I actually, at some moment in my life, thought that the dentist and the physician were related to us. It was at that moment that I knew that's what I wanted to do. That type of relationship was what I wanted to seek. So I went to undergrad and I did osteoporosis research for 4 years. It's about the third year that I started to figure out something's wrong, something's different. Instead of hearing about, hey, is Mrs. Jones getting better? I started to hear, hey, what insurance does Mrs. Jones have? How much reimbursement do we get? How many patients do I have to see today? It was something that I really didn't want to do. Now, there's a joke in the medical school world that says, if you don't go to medical school, you go to dental school. So I went to dental school. And it was a little bit easier of a transition for me because my brother was there. And it was awesome. I mean, I got to make people better, and I got to form relationships. Now, in dental school, if you're ever there and you get a filling done, it takes about 3 hours. So we had a lot of time to form those relationships. But what was different was I enjoyed it. And so I go to graduate. And now graduation was a big deal for me. In fact, what happened in graduation, as you can see on this picture, this is a paradigm shift, everybody. Because 6 years prior to this picture, those are two brothers that were ready to kill each other. And it's a paradigm shift in our family because my brother got to hood me. And I left school, and my first year, I was just getting my feet on the ground. I was just trying to figure out, hey, what is this whole dental thing about? And then the second year, I started figuring out something's missing. It's not like it was in school. There's something different. I started to study it. I really started to have a passion for it. And I found something out. I found out that I was part of a healthcare system that lost its soul. What happened was a system that was based on relationships was now based on what insurance do you have? How much is that going to cost? Are you in network? What was weird was there was no more advocates for any patients. I mean, true advocates. People that actually care about others more than themselves. Advocates of people that they just don't put it in their name. They actually do those things. So I was like, man, that is weird because all my physician friends, you take any hygienist, you take a nurse, and you ask them, why are you in this? And they go, I'm in it for the patient. Well, if that's the case, and patient-centered models are all over the place, why is the system still broke? The reality is, the system doesn't allow us to do it. 3 things have changed the landscape of healthcare: insurance, government, and patients. I'm going to give you a little hint. There's only one of those that really matter. Insurance. Way long ago, someone real smart said, hey, the hospitals and the doctors are making a lot of money, and we need to push that more into the insurance pockets. Then somebody even smarter came along and said, we got to figure out how to do that. I got an idea. We're going to make an insurance drug. That insurance drug is going to call in-network. And what they're going to do is, we're going to tell patients, if you go in-network, you're going to save a lot of money. And then we're going to go to the doctors and we're going to say, hey, listen, if you see these in-network people, man, you're going to see a lot of people and you're going to make a lot of money. And then they got them hooked on the drug, and then they decreased reimbursement. They made the premiums higher. I mean, it is really a mind-boggling situation. You have one of the few companies in America where they can go ahead and increase their prices, and their product continues to get worse. What happens in insurance should not occur. Listen, in dentistry, $1,500 in 1980, $1,500 you were allotted to spend in insurance. In 2017, you're allotted $1,500. You know what? I did learn something, a couple things about insurance. One, insurance had an unintended consequence. The unintended consequence was they put business before patients in healthcare. That was one. Two, I can learn to be an advocate from an insurance company Because an insurance company is a great advocate for their stockholders, just not for the patient. Second's the government. You know, this is a hot topic that's going around the world. We have individuals making policies on healthcare based on votes, not based on making people better. We have people that have never advocated for one patient going ahead and setting the landscape for the entire healthcare system. I've heard for the last 10 years about, Dr. Acierno, what do you think? I mean, all these new people are insured. I think it's great. The more the merrier. The problem is we have given a product to a majority of people that if they use it, they go bankrupt. Now we have the patients. Patients are pretty simple. You know, we've become very complicated. However, all we want is quality care. We want it to be efficient. Some might call that fast. We want to make sure that people actually care that we get better. And we would like it affordable. Okay. So now, I'm somebody that's a big Walt Disney fan. And what Walt Disney says is, you make it for what they want, not for what you want. That's our customer. The patient is our customer. We better learn how to figure out what they want. So what if? What if altruism, where you actually cared about others more than yourself, was back in healthcare? What if teamwork was brought in all our hospital systems and in our dental offices? I mean, true teamwork. Teamwork where there's efficiencies and there's affordability. Where team members actually want to come and work in your place, not have to. What if we gave doctors the time and the tools to make excellent quality healthcare? Once again, where we're number one, not back in the pack. Now's the time to change healthcare. The paradigm shift is that we have to make patients better. I cannot control that insurance and government have brought in negative influences. I cannot let them, though, put wedges between the patients and us. Business and healthcare have to learn to coexist. What business has to realize is that the profit is different than a t-shirt company. In healthcare, at the end of our fingertips is a mind, a body, and a heart that cares about us making the right decision for them. This is not a call to action. This is being done today. We have been able to put a business model together that is sustainable with great quality healthcare. We have 27 colleagues that have this vision, that make decisions every single day based on altruism, teamwork, and excellence. I'm not here to tell you that it's easy. I'm here to tell you that it's hard. I'm here to tell you that there's a lot of negative influences out there that's trying to make it hard. But I'm going to tell you that we're going down trying. This is too important for everybody out there. I am happy to say that we have once again found the soul in healthcare. Thank you.